Hello everyone. The topic of today's presentation is the nasal septum. Today we will be talking about the anatomy of nasal septum, basically consisting the structure forming the nasal septum, the arterial supply, the venous drainage, the nerve supply, lymphatic drainage, and lastly the clinical importance. So now let's get our presentation started. So firstly, what is nasal septum? Nasal septum is a medial osteocartilaginous partition between two halves of nasal cavity. Here, this diagram represents the sagittal section. Here we can see this is the nasal septum, and in human body, it is covered by the mucous membrane. The diagram does not consist of the mucous membrane because it simply depicts the structure forming the nasal septum. And as we discussed before, it is the partition between two half of the nasal cavity, so it forms the medial wall of both the nasal cavity. Now, regarding the formation of nasal septum, it basically consists of the bony part and cartilaginous part. Bony part we can divide into major and minor. Under major, we have vomer and perpendicular plate of ethmoid. And under minor, we have nasal plate of frontal, rostrum of sphenoid, nasal crest of nasal bone, palatine bone, and maxillary bone. And under cartilaginous part, we have septal cartilage and septal process of inferior nasal cartilage. Now let's correlate it with our diagram. Here we can see this shows the formation of the nasal septum. The main or bony part, it consists of the vomer and perpendicular plate of ethmoid bone, and further other minor bony part, it consists of rostrum of sphenoid, crest of palatine bone, crest of maxilla, anterior nasal septum of maxilla, crest of nasal bone, and nasal spine of frontal bone. And under the cartilaginous part, we have septal cartilage and cartilaginous part. And here we can see this part. This is the columella, and columella is the lower margin of these. This is the lower margin of the septum, and the cuticular part, or this lower end, which we call this cuticle part because it is covered by the skin. So this is the basic formation of the nasal septum. And regarding borders, as we can see in the diagram, that it consists of superior, inferior, anterior, and posterior borders. And regarding surface, as discussed before, it is the partition between the two nasal cavities, so it consists of right and left. And arterial supply, to make the process easy or to make the better understanding of the arterial supply, we divide the nasal septum into four quadrants: anterior superior, anterior inferior, posterior superior, and posterior inferior. Anterior superior, it is supplied by the anterior and posterior ethmoidal arteries, which is the branch of ophthalmic artery, which is further the branch of internal carotid artery. And anterior inferior, it is supplied by the posterior labial artery, which is the branch of facial artery, and it is the branch of external carotid artery. And sphenopalatine artery, it supplies the posterior superior part, and posterior inferior part, it is supplied by the few branches of greater palatine artery. These two arteries are the branch of the maxillary artery, and this further is the branch of external carotid artery. So from this diagram, we can understand that the main arteries supplying are the internal carotid artery and the external carotid artery, of which the sphenopalatine artery, it is the main artery to supply the nasal septum. Now let's correlate with the diagram. Here we can see the depiction of four quadrants by our imaginary lines. The anterior superior part, it is supplied by the anterior and posterior ethmoidal artery. The anterior inferior part, it is supplied by the superior labial artery. And here we can see the posterior superior part, it is supplied by the sphenopalatine artery, and posterior inferior is supplied by the sphenopalatine and the branches of greater palatine artery. Regarding the venous drainage, as in arterial supply, to make the understanding better, we have divided it into anterior and posterior part. Anterior part, it drains through the facial vein, and posterior through pterygoid venous plexus. And regarding the nerve supply, it consists of only the sensory nerve and it lacks motor nerve. And under sensory nerve, further we have divided into general sensory nerve and special sensory nerve. Under special sensory nerve, we have internal nasal branch of anterior ethmoidal nerve, anterior superior alveolar nerve, medial posterior superior nasal branches, nasopalatine branches. And under special sensory nerve, we have olfactory nerve. And as in arterial supply, we have divided the nasal septum into four quadrants, and it is correspondingly supplied. So in the anterior superior part, it is supplied by the anterior anterior ethmoidal nerve. In the anterior inferior part, it is supplied by the alveolar nerve, and the posterior superior part is supplied by the superior nasal branches, and posterior inferior part, it is supplied by the nasopalatine branch. Now let's again correlate with the diagrammatic view. Here we can see that the depiction of four quadrants. And anterior superior, it is supplied by the anterior ethmoidal nerve. This one is the anterior inferior part, which is supplied by the anterior superior alveolar nerve. The posterior superior part is supplied by the median posterior superior nasal branches, and the inferior posterior inferior part, it is supplied by the nasopalatine. So these are the general sensory nerve, and the special sensory nerve is the olfactory nerve. And here in the diagram, we can see the olfactory rootlets. This is the nerve supply. Now regarding lymphatic drainage, as in venous drainage, we have divided the part into anterior and posterior. Anterior drains into submandibular node, and posterior drains into deep cervical node and retropharyngeal node. Now our last topic, so clinical importance. Here, what is epistaxis? For this, let's take the help of the diagrammatic view of the arterial supply. Here we can see the arterial supply, the portion which is demarcated by this blue line, it is the Little's area, which is supplied by the anterior ethmoidal artery, superior labial artery, and sphenopalatine artery. It consists of the three arterial supply, and it lacks the posterior ethmoidal artery. So this area, it is called Little's area or Kesselbach's area, and it is the most common site of nasal bleeding, and the nasal bleeding we call it epistaxis. So it is very clinically important, and we should manage it carefully because it can lead to much bleeding and cause more complications. So hope that you find the video very fruitful. If you have any questions, please leave that in the comment section. I will try to address them. Thank you so much.